Perfect. Well, thank you so much for that introduction. And I'm so happy to be here today. And I just wanted to start off by thanking Dr. Floyd for inviting me here, and then also Ingrid and Serena for your assistance this morning. So, I don't have any financial disclosures, but I do have some personal disclosures. So, today we're going to talk about historical traumas in order to understand the context of American Indian Alaska Native health inequities. And when we're talking about these health inequities, this is not just a group of people I'm describing. These are my ancestors and these are my relatives. So this is a really personal talk today. And as mentioned, I'm a citizen of the Confederated Tribes of Grand Ronde. That is one tribe out of over 570 tribes. So I do not represent all American Indian and Alaska Native people. And today I had my formal academic introduction, but if I were being introduced culturally, I actually would start my introduction by introducing who I'm related to, my relatives. I also would do a place-based one. So today I'm going to spare you. I'm not going to tell you who my great grandparents and grandmothers and all of that, but I am going to introduce you to my land. So this is Spirit Mountain, and this is found on my reservation in Grand Ronde, which is about an hour and a half southwest of Portland, Oregon. And I travel there once a week to provide care. And every once in a while, I'm able to escape during my lunch and go on a walk. And I often look up at Spirit Mountain and remind myself why I'm doing this. And that my ancestors also looked up at this mountain and that they're giving me strength to do this work. So we've already had a land acknowledgement. So I'm not going to do that. And I was so happy to see that you did a land acknowledgement for each one of your grand rounds. And that's something I definitely want to take back to my university. But I also wanted to personally thank the Muwekma Ohlone tribe for allowing me to be here today on their land. So today we're going to be reviewing the health inequities that exist for American Indian Alaska Natives. We'll compare Indian health service to other healthcare systems, and then I want to spend some time describing current efforts and pathways to increase the number of American Indian Alaska Natives going into medicine, particularly at OHSU at our Northwest Native American Center of Excellence. So first, I'm going to start off by talking a little bit about terms because we have been using them interchangeably already throughout this presentation. And so starting off with Indigenous people. So there actually is no common definition for Indigenous people, but the UN describes it as a distinct social and cultural groups who share collective ancestral ties to the lands and natural resources where they live or where they've been displaced. So really, it's the original inhabitants of a land prior to colonization. American Indian and Alaska Native are Indigenous people from the lower 48 or from the state of Alaska. But these are really important terms because they're actually political designations. So for people who are American Indian and Alaska Native, who are citizens of federally recognized tribes, we have a unique political status, not just a race. This status is established by Congress, the Constitution, and treaties, and has been affirmed by the US Supreme Court for over 200 years. And this is why I won't have time to talk about this, but it's in the news. But this is why the Supreme Court hearing on ICWA, or the Indian Child Welfare Act, is so vital and so important. So I encourage you all to look into that. The term Native American is really a term that came out in the 1970s, and it is used more as a way to encompass all Indigenous people from America. We often use it when we talk about American Indian, Alaska Native, and Native Hawaiian, but it doesn't have a political designation. And then lastly, federally recognized tribes. So what exactly does this mean? This means that the federal government sees a tribe as a sovereign nation. And because of that, because of treaties signed by our ancestors, there's a federal obligation to provide services such as healthcare. So I often get asked, okay, so should I use American Indian? Should I use Native American? What should I use? And really, I encourage you all to ask and follow Many people actually would rather be introduced as their tribe. And I would also encourage you to ask how to say that tribal name, because one, it can be complicated, but two, sometimes the names have been given by the colonizers rather than by the tribes themselves. So, talking a little bit about demographics. In 2010, about 1.5% of the population identified as American Indian Alaska Native, either in alone or in combination. And by 2020, 2.9% identified. So we're one of the fastest growing races and ethnicities. About three quarters live off of reservations, so either right off the reservation land, but many actually live in cities. And in fact, Portland is the ninth largest urban Indian population. And this is from a photo taken from Dancing in the Square that we just were able to have again, bring back in person in 2022. As I already mentioned, there are 574 federally recognized tribes in the US in 37 states, but there are many more unrecognized tribes who are fighting for recognition. Additionally, some people ask why just 37 states. That is often because they have been removed from that land. And that has important implications when you think about legislation as well. There are many states that don't have representatives with federally recognized tribes when we're thinking about policy. In Oregon, there are 9 federally recognized tribes. In California, there are 109. So we're going to talk a little bit about health disparities today, but I always put this quote up to remind ourselves that we are not just the health inequities that exist. Um, we have endurance, we have survival, adaptation, and creativity in the face of overwhelming obstacles, and we have enormous contributions to this country. I'll give you a minute to finish reading that. And so I had planned on talking a little bit about American Alaska Native child health inequities today. And I will talk a little bit about this, but I don't really want to focus this on this because I think we all have seen these during COVID and they've really been brought to light. And so I don't want to spend too much time on this. But I do want to point out that adverse childhood experiences, there have been studies that show that American Indian Alaska Native children, 1/4 of them experience 3 or more adverse childhood experiences. And as we know, the more adverse childhood experiences you have, the worse your health outcomes when you become adults. The other thing I wanted to point out is some of the effects of COVID. So while children have been relatively healthy during this time, not affected as much as adults, um, they have been affected by orphanhood. So this was a study that came out in pediatrics, and it's from December of 2021, and it looked at people or children who had lost caregivers for 15 months, and they found that compared to white children, American Indian Alaska Native children were 4.5 times more likely to lose a parent or grandparent caregiver. And 1 out of every 168 American Indian Alaska Native children lost a primary or secondary caregiver. And this, I think, is incredibly important in Native communities. Often it's not just the nuclear family that's raising a child, but the aunties, the grandparents. And I see that often in my tribal clinic when patients come in with their aunts, with their um, grandparents, with their cousins. And so I think this is an unrealized impact of COVID-19 on children. So why do these health inequities exist? This is a big jumbled thing because this is often how it feels. And obviously, if there was one simple answer, there would be a simple solution. Um, but it's not. This is a nice graph from Kaiser Family Foundation looking at the social determinants of health, and they've added in racism and discrimination. So really, like the systemic and institutional racism that exists. I would also add in for American Indian Alaska Natives historical trauma as well. But when I think particularly about Native Americans. Um, I think about some of the policies, historical policies, that have placed reservations, often in rural areas, on lands that have unwanted away from urban areas. So thinking about um, economic opportunity and jobs. I think about food deserts, and then lastly, the healthcare system or Indian health services. And so I think one of the things I always like to point out is when you think about, okay, access to safe drinking water, like that's just a given here in the United States. And we often don't think about it here in the US. But this is actually a tribe in Oregon that every single year there's some newspaper article about their access to safe drinking water. So this is the Warm Spring Reservation, and it's about 2 hours away from Portland, or maybe two and a half, depends on how fast you drive. But as you can see, um, they don't have access to safe drinking water regularly. And it doesn't just affect their ability to wash their hands during COVID, to drink water, but it also is affecting their culture as well. This is one that was a time when they were trying to do the root feast and weren't able to do that. And this is just reminding us how close Warm Spring is to Portland, which is the largest city in Oregon. And so I wanted to talk a little bit about Indian health services and why we need more American Indian Alaska Natives going into healthcare. But when I started thinking about this, I realized that we needed to talk a little bit about the history. And to do that is to talk about some of the historical trauma. It'll also help put some of the health inequities in context and help us understand the structure of Indian health services and why that we need three different structures for Indian health services, which is federal, tribal, and urban. So today we're going to talk about Oregon tribes in particular, because that's the oral history that has been passed down to me and that I know the best. But I want to remind everyone that many of the policies that we talk about today affected tribes across the United States and in California. I also want to remind everyone that this can be particularly triggering, so a reminder to take care of yourself. So this is the state of Oregon prior to colonization, and there were over 12 dozen tribes. As I've mentioned earlier, there are now only 9. They've been consolidated down, and there were 12 different languages that were spoken. Like California, Oregon has many different geographic regions. And really, these regions help determine a tribe's culture, their ceremonies, their traditional foods, their technologies, whether they were stationary or migratory. And so we had coastal, we had river, we had plains, and we had different desert tribes. But one thing that was the same across all of these tribes is the idea of land ownership. There wasn't land ownership, because how could you own land when it's a living and breathing thing? Um, so with 1850, there was a mass migration of people to Oregon, white settlers. And about the same time, there also, I think, the California Gold Rush was going on, and so there was mass migration to California as well. So they want to encourage people to go to Oregon too. And so they did the Oregon Donation Land Act. And so this is about the 1850s. This gave married men 320 acres, and women, if they were married, 320. Couldn't get any if you were unmarried. So that's, a discussion for another day, another lecture. But I wanted to show this map here because I just find that it's so interesting that we see the impacts of this today. So they gave away this land in checkers. And as you can see, this is a Google map. Looking at it, you can still see this today, the public lands versus the private lands. And you can see that it's much easier logged on the private land. So you can see it actually in the map. But as you can imagine, with all these people moving to Oregon and it being given quote unquote free land, when there was already inhabitants living on this land, led to a lot of conflict. With people moving here as well came a lot of new diseases, as we have seen in our current current pandemic. A new introduction of diseases can be devastating, and it was devastating for many tribes. And so there was introduction of diseases, influenza, measles, smallpox, tuberculosis, and so many tribes, because of this, because they had lost men to the violence, because they had lost elders, children to the different diseases, signed treaties with the US government in order to stop the violence, and to move to a reservation that was going to be provided for the US government where they could live. I'm going to talk a little bit about one of those treaties because that impacted my tribe in particular. That's the coastal treaty. And so it was supposed to include 105 miles along the coast and include over 1 million acres. In addition to receiving this land, they tribes were also promised services as well. Unfortunately, this treaty wasn't ever ratified. So that means that by the time that it got back to the US government, they didn't sign the treaty. But by this time, my ancestors, my tribe from the Umpqua tribe, had already moved to a holding land or holding reservation until this new coastal treaty, or sorry, coastal reservation was ready. And as you probably saw from the map, there is no coastal reservation. And in fact, it's two much smaller reservations that we see now, the Siletz and Grand Ronde. So this is Table Rock. This is down in Southern Oregon. This is where they moved many of the tribes when they got them to sign that coastal treaty. And like I said, this is a very personal story. Um, okay. Um, these are my ancestors. This is Solomon Riggs and Jenny Riggs, and they were actually here at Table Rock. And in fact, my nephew, Solomon, is named after Solomon Riggs. But during the winter of 1856, they were marched nearly 300 miles from Southern Oregon up to what is now the Grand Ronde Reservation in February. Have any of you been to Oregon in February? It is not a place that you want to be marching over 300 miles, and it took them 33 days. And so we often learn about the Trail of Tears for the Cherokee Nation, but many tribes have their own Trail of Tears. Like I said, I would share a little bit about the changing policies. And so the US government at first worked on eliminating and containing Native Americans. But then they decided, okay, let's work on instead assimilation. And one such tactic was Indian boarding schools that also started in the later half of the 18th century. And so this is a photo taken from Chamawa Indian Boarding School. This is the longest running Indian boarding school in the US. It is located in Salem, Oregon. But really, Indian boarding schools were created with the motto, kill the Indian, save the man. And so children were often taken away from their families as young as 5 years old. They were brought to these schools where their hair was cut. They weren't allowed to wear their traditional clothing. They changed their names. They couldn't speak their language or practice their culture. And if they did, they were often punished. Recently, there has been a report that has come out about Indian boarding school that was commissioned by the Department of the Interior. And I encourage you all, this is just the first chapter that has come out, but it highlights some of um, the negative things that were happening at many of these boarding schools. And I think we haven't quite yet realized the long term impact this has had on generations. But when you think about it, We're taking, as a pediatrician, you're taking children away from their nurturing environment, their parents, all that love and support that they receive. And then additionally, you're taking away their culture, their identity. And we know that Native American identity is protective. Um, so my grandma actually attended Chemawa Indian boarding school. Um, by the time that she went there in the 1930s, policies had changed. You weren't punished, but she was taught not to be proud of being Native American. And so she didn't learn much of her culture. Um, and so that unfortunately was passed down to my mom as well. Another policy that the US government had for assimilation was termination. Um, and so in 1950s, the US government terminated a number of tribes in the United States.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.